Growing outrage and pushback this morning from San Francisco city leaders over a controversial program that gives free alcohol to homeless alcoholics. Now, the city-run initiative is called the Managed Alcohol Program, or MAP. It's been around for 4 years and has cost the city roughly $20 million. Supporters say the goal isn't to eliminate alcohol use, but rather to keep individuals at a, quote, safe level of intoxication, aiming to increase their safety and overall quality of life. But critics, like our next guest, says this is only making the problem worse, and the city should be focusing on helping these people beat their addiction. Tom Wolf is a formerly homeless recovering heroin addict from San Francisco. He's gone on to start the California Peace Coalition. Tom, good morning. Thank you so much for joining us.
Good morning, Hannah. It's great to be here.
So first, explain how this program works. Can any homeless person just walk in and simply ask for a beer?
No, that's not how it works. Basically, you have to enroll in a program, or you're identified as someone that has chronic alcoholism, usually because they've had many hospital visits in the past, et cetera, and then they're offered this program that comes with a variety of other services. Of course, it's not just giving someone free vodka all the time. They've been determined to be very, very sick with late-stage alcoholism, and the hope is that this program will keep them out of the hospital and potentially keep them alive.
You're someone who personally experienced homelessness and addiction. Do you think this program is going to help people? Also, how different is it from a safe injection site that we've also seen pop up in parts around the country?
Well, the way I try to frame this is that, look, I understand the concept, okay? But as someone that used to use heroin on the street, if you enrolled me in a program where they were just giving me half of the dose of heroin that I normally take every day in the hopes that I wouldn't use more, to be quite frank with you, I would probably still be on the street and still using, or I'd be dead from drug overdose at this point. So you have to really wonder, for the amount of money that the city is spending on this program, is the outcomes of the program actually worth the investment? Now, this is very different than a safe injection site. A safe injection site, first of all, is against federal law because you can use illicit drugs inside a safe injection site, like fentanyl or meth or crack cocaine. This is alcohol, which is 100% legal that they're giving folks. So yeah, two different things. But basically, they're both there to try to just manage someone's addiction in perpetuity instead of promoting recovery or trying to, usher someone into treatment so they can actually leave their addiction behind.
So last October, the leaders of this program conducted a seminar for the University of California, San Francisco. They described how they calculate how much alcohol is given to a certain person. Let's listen to that. I'll talk to you on the other side, Tom.
We use the term SDE, or standard drink equivalent. 1 SDE is equivalent to 50 cc's of vodka or liquor, 12 ounces of a 5% beer, or 5 ounces of a 12% wine. So you can see, for example, the first person here drinks vodka and gets a total of 16 SDEs a day. They get 3 SDEs at 6 a.m., 10 a.m., 2 p.m., 6 p.m., and then 4 at 10 p.m. overnight.
Okay, so this is one example, but just breaking down the numbers of an SDE, as they call it, is the equivalent to 1 shot of vodka. That person is getting 16 shots every single day. So is this program really helping that person? And of course, I know alcohol is a real addiction with real physical effects, but does it really help this person giving them essentially 16 shots of vodka?
Well, that's really the question, and that's why we're here talking today. So is our Department of Public Health's job to keep people healthy or to keep people sick? And if you're an alcoholic and they're giving you 16 drinks a day, that's actually keeping you in your alcoholism or keeping you in your addiction. Again, if I was, a fentanyl addict and they were just giving me 3 shots of fentanyl a day instead of 6, is that keeping me sick? Or is that helping me get well? Well, it's not helping me get well, because at the end of the day, I'm still addicted to that substance. And the goal should be to get people into recovery and to get them away or break that chain of addiction for that individual. And what's frustrating for me is the cost. So we're spending $5 million a year to service a total of 55 people. And that's so $20 million over 4 years for a total of 55 people for that entire 4-year period. That's $363,000 per individual that we spent on this program. For that price, you could have opened a drug treatment center with 60 beds.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.